So the next MCQs here is 12-year-old Caucasian boy, again a Caucasian boy, is unable to walk and suffers from progressive scoliosis. He is wheelchair bound. Genetic studies show a deletion of dystrophin gene located on the X chromosome. His calves are enlarged and non-tender. Biopsy of the calf is most likely to show which of the following. So here are the options: hypertrophic muscle fibers, multiple lipid droplets within the muscle fibers, prominent inflammatory infiltrates, fibrofatty muscle replacement, ragged red fibers. So what could be the answer? So first of all, you can see here in question that there is dystrophin gene which is mutated, deleted. So the mutation of dystrophin gene causes duchene muscle dystrophy. This is X-linked recessive, as we have here X chromosome. That's why it occurs only in males, and we also have a boy here. Dystrophin is a structural protein. Structural mean it is involved in the structure of muscle fibers. The absence of dystrophin gene causes muscle fiber destruction, which is called myonecrosis. On light microscopy, we can see variation of muscle fiber size and shapes, and regenerating fibers, increased amount of connective tissues are seen. These are the complex of the things which you can see on the light microscopy. So the disease onset is between 3 to 6 years of age, and the age of boy here is 12 years. So disease start at 3 to 6 years of age. Muscles of lower back, you can say lower back, pelvic and shoulder girdles. As you can see, these are the proximal muscles which are located in the center of our body. Lower back, pelvic and shoulder girdle and proximal muscles of extremities are affected. Symptoms of duchene are this: walking difficulties, waddling gait. We can see waddling gait. Parents often complain that the children are clumsy, walk slow, and don't keep up with their peers. Progressive weakness is seen in the proximal musculature. If we allow the boy to sit on the chair and ask him to stand up, he will use his hands to force him to stand, as the proximal muscles of the leg are weak. Quadriceps, you can say, and hamstrings are very weak, and this sign is called Gower sign. And the next symptom, we can see distal muscles of the extremities such as calf are enlarged. Initially their muscle hypertrophy is true. Initially there is true muscle hypertrophy, which is then followed by the fat and connective tissue deposition. These changes are called pseudo hypertrophy. The next symptom is asymmetric weakening of paraspinal muscles leading to kyphoscoliosis. The muscles which are involved in the straightening of our, or you can say this boy's spinal vertebrae, when these muscles become weak, then there is changing in the straightness, which we can see as kyphoscoliosis. So the the most probable option is fibrofatty muscle replacement. You can see fibrofatty muscle replacement of the muscles, proper muscles. So why not hypertrophy muscle fibers? Why not hypertrophy muscle fibers? These occur only in the early stage of duchenne muscle dystrophy, as the disease start in 3 to 6 years of age. So, and the boy age is 12 years in the question. So the disease process has been occurred a lot. That's why the most likely fibrofatty change would occur at this age. We are dealing with the boy at 12 years of age. That's why the answer could not be A. Option B. Why option B is not? Multiple lipid droplet within the muscle fibers. These lipid droplet accumulation only seen in the lipid myopathies. Carnitine, palmitoyl transferase deficiency is the example. Answer C. Prominent inflammatory infiltrates. Prominent inflammatory infiltrates often occur in polymyositis and dermatomyositis. These conditions involve proximal muscle weakness without distal pseudotrophies. pseudohypertrophies. Why not answer E? Ragged red fibers. Ragged red fibers actually refer to the muscles with irregular contour. The contour is irregular and blotchy red appearance, and these are seen in mitochondrial myopathies. So duchene muscle dystrophy is a proximal muscle weakness and atrophy. Afterward, atrophy occurs.